Okay, so once we've finished all our soft tissue techniques, we can then move on to what I classify as some glenohumeral mobilisations. And this is obviously to explore and free up usually the posterior capsule. We've got three range of movements where we're going to apply these mobilisation techniques. So the first one's going to be in abduction, the second one will be flexion, and then the last one will be external rotation. So you've just got to make sure that your clients have got pain-free range in those areas. If they're feeling any pinching or grabbing, then obviously you need to back off. But the beauty of these techniques is that we're actually going to take them out of those impingement zones. So we're going to traction the joint and then we're going to depress it and then move through those ranges of movement. So the first one's going to be the abduction mobilisation. So you're going to position your client, have their shoulder just slightly just off the table a little bit, so half on and half off in terms of their shoulder joint. Bring your hand just above their elbow so that you can sort of control the free arm and the forearm there. We're going to traction, so that means you're going to pull towards you and then you're going to depress over the shoulder itself, okay? And just pick up that end feel range. So you'll probably feel a little bit of a bounce there. So make sure that you traction, depress down, and then you're going to take them through into abduction. Now, you're only going to go take them through say about 20 or 30 degrees abduction, and then you can slowly just work up into the higher ranges, okay? So I like to just explore the range as I work through, and you'll try and find that end feel, come back out, traction, depress again, come up a little bit further, and then mobilisation into the next range of movement. So always start off below 90 degrees and work your way up into 120, and you'll find that as you work through abduction, you'll start to really feel the posterior capsule really just free up. So remember, principle will be traction, depression, then take them into that range, all right? So just explore those end of range movements. If you're getting any catching or grabbing, then obviously you need to stop. But as I said before, you're actually taking them out of those positions. So that's abduction. Now, if we look at the next one, which will be external rotation, we're going to do a similar process, but this time you're going to make sure that your clients are going to be into this position. Okay, so we're going to be mobilising them into external rotation. So it's the same principle again. The only difference here is obviously controlling the elbow. You're going to wrap around the back, okay, traction out towards you again, and then depress. And then once you've got them in that position, hold that down. You're going to bring your arm up, let them rest up against your thigh, and then take them into external rotation. So once again, just explore that end range, making sure that you've got that shoulder depressed and into that range, okay, like so. So it's really important that they're supported here on your thigh. If they're not, they're going to fall away, and then obviously you're going to lose that depression component. Right, the last one's going to be flexion. So this time it's a little bit different. It's the same principle, but this time it's going to be different from the point of view of how we traction and where our movement's going. So once again, we're going to traction up and away, but your hand's going to come around just over the tricep, and then you're going to pull up, and then you're going to traction the joint up into that flexion plane. So just pushing up, find the end feel, and then just mobilise into that. So once again, there should be no pain on this. And what you're trying to do once again is just mobilise that posterior capsule. All right, so to recap, obviously abduction, external rotation, and then flexion. Traction, depression, and then range of movement.